Introduce yourself.
Well, my name is Amir Savage. I'm a specialist periodontist based in Islington. I've got about 10 to 12 years of implant experience and periodontal surgical experience as well. I think I've been on this course, and it caters for a wide range of experience from starting your implant career to the very advanced. It's very good because it's got little nuggets of information that you take away and use in everyday clinical practice. And I think certainly for me, what was very, very useful was looking at the various options regarding management of sinuses, sort of sinus lifts and things like that. Certainly there is clinical tips that you could use in everyday practice, and certainly I will probably be doing that on Monday morning.
Super. Yes, so I mean, you've already touched upon it. It's quite difficult to cater for the range of experience that the delegates have, and you're the more kind of advanced end, and I think you'll certainly get some value from the sinus lift, DASC and piezo approaches that we'll demonstrate today. The other kind of, I guess it's really important to demystify a lot of the things. That there's a lot of apprehension and anxiety over, for example, anatomy and the sinus, and that's always a really important part of my job is to do that. Do you think we've managed to achieve that?
Yeah, I think one of the main things is that because you come from a maxillofacial cancer care background, you know the anatomy, you're very familiar with the anatomy, and you sort of put it in perspective to the treatments we're doing. Yes, we're planning implant treatment, we're carrying it out well, but there shouldn't be any sort of fear of the anatomy. And I think as long as you know where the important structures are, as you clearly do, you really will not get into trouble. And I think that's the main take-home message, is that know the anatomy and do not be afraid of the areas that you're actually going to be working in. Super.
So it's that reassurance, I guess. We've also had some PRF demonstration, which I'm using more and more so, as well as the Versa osseodensification techniques. And we've handled a variety of bone grafting materials as well. I know you're probably quite familiar with that and the connective tissue. The live surgery of value to you. Did you take anything away from that?
Yeah, I think it's always good to see how other people carry out their treatments. You can always learn a lot from it, and I think it was very useful to see the workflow, the interactions, the instrument exchange as such, and also how certain problems were overcome as well. I think the surgery case we did was planned as a connective tissue graft, but looking at the actual case itself, we didn't need to do that. So it's always knowing and saying, well, this is a plan, but having various options that you could actually follow through.
Super. And I guess we've called it the full surgical repertoire. I wanted to have as many techniques condensed into the couple of days. Do you think we managed to achieve that?
Oh, undoubtedly, yeah. I think you've pretty much been able to condense several courses into 2 days. The amount of learning that you would get in probably about 2-3 months of training is what you've been able to sort of summarize into these 2 days, and that's quite hard to do. So for me, very useful, and I'm quite happy with the course.
Brilliant. And one final question: would you recommend us to your friends and colleagues?
Oh, indeed, undoubtedly.
Super. Thank you very much.
Welcome.
General dentist from Maidstone in Kent. I've been involved with placing implants for probably about the last 10 to 12 years. Decided I wanted to come on this course. It seemed to offer quite a lot within the 2 days, some more advanced tips, tricks, experiences, things that would help me in my sort of clinical day-to-day practice. My feeling on a course is I always really want to come away with at least one good bit of information, something that's really going to help my day-to-day practice. On this course, I've picked up many tips that I'm going to take away and use literally next week on my next case. I've really enjoyed it. It's been excellent 2 days.
Fantastic. I mean, it's one of the difficulties of trying to cater for individuals, clinicians with varying levels of clinical practice, is to be able to achieve that, is to be able to cater for both beginners and advanced. And I've pitched this across both of those remits. Do you think we've managed to kind of cater to your specific demands because you're a little bit more advanced than some of the other delegates?
Yeah, definitely. Yeah, absolutely. Plenty of opportunity to discuss points, ask questions. There's quite a lot of information that's come through in the 2 days. Not overburdening you with it, but a lot of information to take in and really compressed loads into these 2 days.
So we've kind of the structure of the course. We have a bit of didactic teaching in the morning, but the emphasis, of course, isn't just on that. It's on some hands-on, trying the various techniques, including connective tissue grafting. We did we looked at the various ways of suturing with economy of movement, hand-eye coordination. What's been the highlight for you then? We've got the sinus and live surgery demonstration in a little bit, but any kind of high points of particular value to you?
For myself, the connective tissue grafting is something I've not really been overly confident with, so having had a demonstration, having had a sort of a hands-on attempt at it really has sort of solidified that's something I can take away, and literally again, like if I need to, I could do that next Thursday for myself.
Fantastic. We've had a lot of PRF. We're going to take some PRF. We had a demonstration of that yesterday. We're going to use PRF for a sinus lift with a membrane. Is that something, again, that you think you might want to incorporate into your practice? Are you convinced by it, or the technique?
I think the technique is straightforward, yes. And if I feel that that's something that I can use in my practice, then I feel perfectly confident in doing so, yes.
Brilliant. And we've called it the full surgical repertoire. Do you think we've achieved that goal?
Yeah, I think definitely. You've covered a lot, like I said, a heck of a lot in these 2 days. And it's gone from start to finish and to the more complicated processes that may be daunting to certain practitioners, but I think it's been covered really concisely and really clearly.
Okay, super.
Okay. So my name's James. I work in Knutsford. I'm just doing a full surgical repertoire course this weekend with JAG. I'm quite early on in my implant career. I've done a 10-day advanced course with JAG, placed about 18 to 20 implants in that, but I'm yet to place on my own practice, although I am doing so soon. But I'm thinking of the future of my implant career and where it might head in the years to come, so I thought it was advantageous to come on this course and see a live sinus lift, bit of connective tissue grafting and bone grafting for a high lip line case.
Yeah, I mean, I think one of the things I kind of reassured you and emphasised in your 10-day course was to really get on board all of the more advanced techniques very early on in your implant career and try to embrace that. It's nothing to be afraid of. You know, it's important to try to simplify a lot of this complex implant dentistry. And do you think we've managed to achieve that with the course over the last couple of days?
Yes, definitely. I think that although I'm probably the most inexperienced delegate here on this course today, it's opened my eyes to what the future could hold in terms of implant dentistry, and talking to my peers who've got experience of doing more advanced cases has reassured me that once I've done some simplistic ones in practice, I should be able to step onto those more advanced cases in my own surgery.
So, you know, I think it's important to demystify a lot of this, simplify it. Anybody can do it. I think it's just tailoring that training approach, personalising it to the individual. Any highlights of the course over the last couple of days? We still have the sinus lift live demonstration coming up in a little bit, but any bits that you particularly took value from?
I thought that the use of ethos is probably really good for me, actually, because I have only handled a few bone grafting materials in my implant course, so it was good to get exposure to ethos and use that on the model and see that in the high lip line case, because having used that now and seen it being used, I feel confident to be able to use that in practice. And I suppose the fact that it doesn't need a membrane is particularly simple to use, would be good in everyday practice.
Super. We've got you raising a connective tissue graft on a pig's head, and you're doing some piezo surgery at the moment on some eggshells. We had a live surgery connective tissue, a live surgery high lip line case yesterday as well, with some versa osteodensification. And what about PRF? What's your thoughts on PRF? Is something you think you might want to... I mean, technically, I think it's a very simple procedure. It's something that you feel comfortable about taking away and perhaps using in your practice?
Yeah, I think it's probably for me in years to come, but definitely it seems possible to do. Yeah, definitely getting the blood should be okay most of the time, hopefully. And yeah, something that's it was really interesting to see it and how it sort of gelled up over time when we were adding it to the bone graft material, and it looks like it would be quite achievable to use, really. Yeah.
Final question, James. Thank you for giving us your time. Would you recommend this to your friends and colleagues?
Yes, I would. Yeah, definitely. It's been a really informative course. It's been a friendly, approachable atmosphere, and I would recommend it to anyone. Yes.
Super. Thank you very much.
Okay. I'm Bashir Qasim. I'm a general practitioner, and my implant practice is quite a small practice, and I've done about 400-500 implants. And I did the initial course at Dentally, and since then I've done the diploma in Edinburgh.
Right.
My reason for coming to this course was slightly mixed because I wasn't very sure what I was going to get out of it. But having stayed the 2 days, you've done a fantastic job, because I think you have summarized a lot of the salient points and given quite a few tips. So basically, I think what it says on the tin.
Yeah. If there's a high point of the course or something that's most valuable to you, what would that be?
I think it was more the sort of the nuggets that you passed on, like switcher note, locking, stuff that I could take away tomorrow and use it, rather than be on the course and say, well, I can't afford this or whatever.
Yes.
So I think that was the big thing.
Okay.
And, learned a lot of things that I can go tomorrow and get on with it.
Yeah, sure.
And
That's great to hear. Are you doing much sinus lift or connective tissue grafts? And is that something you think you might be willing to
that
embrace?
was the other thing. This CT graft.
Yeah.
I thought, you went through the technique quite simply, and I could follow what needs to be done.
Yeah.
So that was quite good, and that's something that I could look at.
I think
I've steered away from this sort of things and tend to use membranes and things like that.
Yes.
But this seems to be a fairly straightforward procedure. The way you showed it was very good.
Yeah, I mean, I guess guided bone regeneration has pretty much superseded now block grafting or using autogenous bone with a second site surgery, and having the connective tissue graft built in as part of your armamentarium for certainly high lip line aesthetic cases. We did some PRF work as well. Did you find that of any value?
Yes, that was something that I've always wanted to look into. So that was very good. And so again, I could have gone on a course, spent a whole day, and what you did was in half an hour, condensed in and gave the sort of relevant information.
Sure.
Which is very useful. So it's something that again could look at.
Fantastic.
I'm Sarah. I'm the head nurse here at Shrewsbury. I've been here for 6 years. This is the most advanced compact course I think that we've pretty much done since I've been here.
Okay. I guess your main responsibility was to try to find the suitable cases for the live surgery in the afternoon, and you certainly did that. Both the first day was the high lip line case with the grafting, and then the second day sinus lift.
We've had a couple of months to choose the correct patients. I think delegates were quite pleased in our choice.
Yeah, I think we got some great feedback, and I think it went really well, and I'm sure we'll continue to grow from strength to strength. With
great
future courses.
feedback, happy delegates.
Super. Thank you, Jess. If you just introduce yourself and tell us, you're probably one of the key reasons why this course was delivered, I think, as well as it has. Essentially, you were given the remit to put everything together. I just gave you the topics and subjects. Tell us who you are, firstly.
Okay, my name's Jess Mayrick. I work across the road at Implant team as a clinical advisor. I've been with the business for 8 years, and I also work at Dental as an implant nurse and supporting the delegates after they finish their course.
Super. We've had some great feedback. How do you think it went?
Amazing. A lot of work went into the course, and I think as a team we've delivered it really well, and everyone seemed really happy.
Fantastic. I think you're really proud of what you've delivered, and I'm sure the course will continue to be successful in future events. Thank you.
Thank you.